Capitol Hill, a Supreme Court case, a presidential election, and a Mayan apocalypse that could have stopped it dead in its tracks but didn't? The marquee elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in, and big changes are coming to health insurance in 2014. In the next few minutes, you'll get a pretty good lay of the land by once again watching your fellow Americans, the U-Tunes, find their way through the system. There are 4 main ways nearly all of us will experience health care once the health reform law goes fully into effect. About half of us will get insurance through our jobs, just like today. About a third will get covered by the government through Medicare and Medicaid. About 1 in 10 will buy insurance themselves. And unfortunately, another 30 million of us or so, just under 1 in 10, still may not have coverage at all. But let's begin in the workplace. Many Americans are already covered by their employers, and for them, not a whole lot will change. There will be some new advantages, though, like caps on how much you have to pay out of pocket, and free preventative care. The bigger changes are coming for those who work for larger companies but aren't covered now. That's because the government is going to require companies with 50 or more employees to cover full-time workers or pay a penalty. So, more workers may find themselves covered. Smaller employers won't face the same.
Well, I know it's a very big law, and I know of it, yes, and I know how controversial it is, and I know parts of it, yeah, some parts of it, yeah.
Okay. Do you agree? Do you think it's working? Do you think it's beneficial to the United States citizen for someone who needs a cheaper health care than a private plan? Cheaper health care for the United States?
I don't know about the cheaper necessarily. I think there's a positive in prices. I think there'll be a long-term positive impact on prices, bringing them down over a long term. Right now, I think that's up. It's a little bit up in the air. My opinion is that over the long term, I think they'll be improved. All I know is for sure, you had 40 to 50 million people who didn't have insurance, and they're saying even by the end of this next 2 years that half that number would be cut. That number would be cut in half. So if I'm a person that didn't have insurance and now I have insurance, I don't really care why. You know what I mean?
Mm-hmm.
Ins and outs of the act is well enough to say that, but I think if you say, what would you do?
Yeah,
I don't even know how this solution works, but what I hear is like that single payer idea. If you could somehow, I think it's to make like car insurance. Like you just, we can find the best plan. It doesn't matter where it comes from.
Yeah.
An individual can purchase an individual plan from any company. And then sort of take it away the burden from businesses, take away the burden from your workplace.
Mm-hmm.
As individuals come and go from their work more frequently during their careers, it's going to be an important part of how that plays out. But I think that might put pressure on prices, like have a little bit more competition across it.